Having understood what is depression and the statistics of depression, now we go and look at what are the things that you look out for. How is depression diagnosed? To start with is for you to know that stress is not depression. And for you to be diagnosed with depression, you have to have presented with at least 2 weeks of low, sad mood and loss of interest in many things that you used to do. So depression, you don't wake up one day and just start saying, oh, today I feel depressed. Oh, it has to be after a period of 2 weeks of persistent low, sad mood, almost every day, nearly every day, and loss of interest in things that you used to enjoy. Other signs and symptoms of depression, of course, affects your emotions. And how does it affect your emotion? You present with feeling sadness, a lot of sadness, a lot of emptiness. You also present with loss of pleasure of many things. You stop enjoying your hobbies, you stop enjoying your work, you stop enjoying many things that you used to enjoy. Irritability, you become very irritable. Small things irritate you. A child crying irritates you. Someone talking to you irritates you. A door closing irritates you. Irritability. You also start feeling a lot of worthless and guilt. You start blaming yourself over and over again. You're always feeling worthless. You're feeling guilt. And worthless comes with hopelessness. You feel as if things are just breaking down. Physically, how does the body present physically when you have depression? Number one, it affects your appetite. You either eat a lot or you don't eat. And the effect is so great that it can be observed. Either you lose weight or you gain weight. It affects your sleep. And people with depression, they are either not sleeping at all, or they are sleeping too much, or they sleep and lose their sleep midway and start having many thoughts. So it affects your appetite, it affects your sleep, it affects your energy levels. Energy level, always feeling tired. You're always feeling tired. You have no even energy to shower. You've no energy to cook. You're always feeling tired. It presents with body aches, headaches, back aches, stomach aches, joint aches. You have aches that are not explainable. And of course, also it affects libido. It makes the libido dip. Cognitively, or in terms of your mind and your functioning capacity, it affects your attention and concentration. It affects your ability to make decisions. It affects your ability to follow through even with things. It makes you forgetful. It makes you have slowness. You're generally slow. Your mind feels foggy. That one also happens. In severe cases of it, of course, it presents with suicidal thoughts and the desire to end your life. When you feel as if everything is not working, you're feeling hopeless, you're feeling worthless, you're crying all the time, you feel as if the world is ending, there's desire and even sometimes attempt to end your life. Sometimes depression can present with either social isolation, wanting to stay away with people. You don't want to stay with people. It can present with reckless behavior, impulsivity, doing things that kawaida you cannot do. It presents with overusing substances as a way of coping with the low moods, trying to uplift yourself. So sometimes people present by using substances in a heavy way as a marker of depression. So people present differently. It's not that all the things that I've mentioned affect a person as a whole. So people are different and they present differently. But you either can experience all these symptoms together, or sometimes you can experience minimum of these symptoms. But of key is 2 weeks, almost every day, nearly every day, of low sad mood and loss of interest of the things you used to enjoy. Next, we are going to talk about causes. What causes depression? What is this that brings about these things?